Good evening. Welcome to the Pearl Report. I'm Diana Lin. The advertisements are ubiquitous, claiming long-lasting results in lifting, firming and smoothing facial skin. But these beauty treatments are risky and anyone can wield the high-energy devices used. Now the government has proposed regulations to the consternation of the industry. Why do people take such risks to look more youthful? Do the so-called medical beauty machines work? How do you choose among the myriad services? Producer Christy Leung takes a closer look. Virginia Ho is in her mid-30s.
咁幫你做翻個提升嘅，咁如果係就建議同你做翻部 HIFU 啦。呢邊咧
Virginia began HIFU treatments 2 years ago.
針對譬如話提升啊，去就
For lifting and smoothing wrinkles, I use beauty products regularly and do manual facials in the beauty salon, but the result is not obvious.
效果未必係咁明顯咯。
I think medical beauty treatments are more effective.
比較大啲。
HIFU, which is high intensity focused ultrasound, using ultrasound energy to heat up the collagen under the skin to have an immediate lifting effect and a prolonged effect on the collagen of the skin, depending on the skin tone age. So it's not the chronological age. If people with really saggy skin, a lot of wrinkles, then there may be other treatments such as a facelift, and then using like the HIFU or the Thermage may only improve the condition, but may not to the extent that up to the standard or the expectation of the patients.
Thermage is a brand of machine using radio frequencies. Other popular brands are Euthera and Dublo, using HIFU. HIFU was originally used to destroy cancer tumors in patients. For cosmetic use, the ultrasound energy of 60 to 80 degrees Celsius penetrates 4.5 millimeters subcutaneously to replenish collagen. The ultrasound energy must be focused on a particular subcutaneous point. If the focus and the duration are not properly calibrated, the device could burn the skin or even tissues underneath.
Only 5 seconds, this will cause the burn. So there is a significant risk if you are cooking the tissue to this high temperature. If there is any underlying important organs, such as the eyes, you should be very, very careful. It has been reported that if you really focus it high enough, this will cook up your lens, this will cause blindness.
When
I see news of accidents, I'd ask why. I think I should communicate with the beauticians to get more feedback. They also start with lower intensity on a small area to see if my skin can adapt to it before they continue.
To further tighten her skin, Virginia also has radio frequency treatments every month. RF energy is used to heat up tissues and stimulate collagen production.
I hope to brighten and whiten my skin, reduce whiteheads and have a more even skin tone.
The most popular is HIFU. There's also the latest wrinkle iron to replenish collagen.
Angel Law and her partner run this beauty salon.
About 90% of our customers want to combine manual facials with medical beauty machines. They want to spend the least amount of time for the most obvious result.
In 2012, a woman died after receiving blood transfusion in a beauty salon. Subsequently, the government set up a working group to review high-risk medical beauty procedures. It listed 15 invasive procedures, such as filler injections and chemical peels, that has to be done by registered doctors. Earlier this year, the government suggested doctors must supervise the use of high-risk devices, such as lasers, HIFU, and robotic hair restoration.
These machines are designed for medical use. Plastic surgeons as well as the dermatologists, we develop really high-power sort of machines that can treat a lot of difficult medical conditions. For example, pigmented lesions on the face, but they are being used to treat cosmetic purpose.
At Angel's Salon, these machines are operated by beauticians.
坊間咧都會有好多唔同嘅方法咧，美容師各方面咧都要通過晒所有嘅測試。
The beauticians have to pass tests before using the machines on clients.
最初頭我哋會聽完。
First, we have to learn theories, then have practical sessions.
各個美容師都會瞓低去感受嗰啲。
Every beautician has to lie down and experience the machine treatment to learn the energy level needed for different types of skin.
That's not the principle of knowing how to operate the machine per se. If there are complications that arises, such as scars, burns, infections, now they may need emergency treatment. And so this, of course, can only be done by doctors.
Most vital is trust. I've been coming to the same beauty salon for many years. They're well trained. I chose beauty treatment services, not seeing a doctor to treat an illness. So if there must be doctors and nurses to supervise, I'd find it very strange.
Beauty salons often tell customers to use beauty therapists rather than doctors. But Becky prefers a doctor. She's seeing Vivian Cheng, a general practitioner, to remove some pigment on her skin.
For pigment removal, we need laser treatment and other strong products to improve the skin color or preconditioning. At this stage, it's not proper for her.
Becky also wants to tighten her chin.
So I will design HIFU for her to improve the laxity. It targets on the smart layer and also the soft tissue below the skin. So actually, it will not create too much heat or stimulation on the skin level.
A doctor gives me more confidence. She knows my needs. If I tell her my skin is a bit sensitive today, she knows I need more moisturizing. Before the treatment, she explains in detail the risks and what it'll feel like. I feel safe. Of course I'd go to an aesthetics clinic with registered doctors. Medical beauty centres might not assign a doctor to follow up your condition.
Becky first sought out Dr. Cheng in 2008 after she had laser treatment and a chemical peel by a beautician in a salon.
My face and neck turned red and were extremely itchy. I couldn't go to work as I was really suffering and I couldn't sleep.
Becky has medical history of asthma. The bi-weekly regime of chemical peels and laser treatments likely overstimulated her skin.
I'm sure I told her about the eczema on my face. The beautician said, that's fine, we're trying to enhance the collagen and moisture.
The therapist is not well equipped to make the right clinical judgments, so they cause the side effects.
In their sales pitch, they said they've registered doctors for big brand treatments. I found out later the brand I bought had no doctor to help.
We have a legislative, regulatory responsibility that if anything goes wrong, we are held basically responsible for that. And our own medical council will look into that. But this is not going to happen in a commercial setting.
Choosing a therapist or a doctor for treatment, I personally would look at the risk.
Yoko Zhang is a beauty blogger. She's tried a myriad treatments with high-energy machines such as laser, HIFU and RF. HIFU machines made in different countries vary in energy levels.
They might ask you to have a treatment every 3 weeks. For higher energy ones, once or twice a year.
The energy depends on the intensity as well as duration. So even if you use a low intensity, if you use it long enough, it can also cause a damage.
Yoko says she'd have a therapist do lower energy treatments.
The therapist might use a Korean device on 10 clients a day, but a professional doctor might treat only 1 or 2 patients. Does practice make perfect? I think so.
But she concedes for more risky, high-energy treatments, a doctor might be better.
He would prescribe anti-inflammatory drugs in case of inflammation or infection. Only doctors can do so. Therapists may not be able to go to that level.
Yoko says her live videos in Facebook on medical beauty attract the most views.
They are always in a hurry to try it out. The more they hear people talking about it, the more they feel outdated if they still haven't tried it.
But often they don't know what they're getting into.
Some have asked me about HIFU. Why is it so cheap for 800 ultrasonic shots? I asked, do you know what the device is? She said no. Isn't it HIFU? I asked which country did it come from. She didn't know. When she doesn't know anything, when she goes to a beauty salon, how can she decide if it's the right treatment?
Coming up after the break.
He saw my face was red and swollen, but still continued the treatment.
You have a regulation on the food safety. We have your regulation on drugs, pharmaceuticals, and we don't have on medical devices, and they're being used on the human body.
We agree some cosmetic treatments are risky, so regulate those risky beauty services while turning them into medical care.
More on that when we return. Welcome back to the Pearl Report. Last year, the Consumer Council received more than 240 complaints against medical beauty services, a rise of some 30% from 2014. Earlier this year, the government proposed to ban beauticians from operating high-risk devices, such as lasers, unless they're supervised by doctors. But Christy Leung reports the beauty industry is not pleased. Mandy is seeing Dr. Kenneth Kong about rashes on her face. 2 months ago, she had a CO2 laser treatment done by a beautician.
She says laser is the quickest, most effective way to minimize pores.
But it was problematic.
My face turned extremely red. I couldn't go out, couldn't go to work as my skin was peeling. My skin was so itchy I couldn't sleep. It lasted more than a week.
The removal is too deep, actually. The laser actually has a temperature of around 400 degrees Celsius. CO2 laser vaporize or totally remove the skin immediately. Usually they create minimal damage.
I didn't know this laser treatment is so complicated and risky. I told them my skin was sensitive and easily turned red. But they said many clients have the same treatment with no problem.
It emits many beams over the whole face to remove certain thickness over the epidermis, which will stimulate the dermis to grow, and there will be more collagen synthesis and better dermis outlook. Before the treatment, we need to make diagnosis, very detailed history taking and physical examination. You should have very healthy skin in order to receive such kind of energy.
Karen had CO2 laser treatment in a beauty salon a year ago to remove warts on her forehead.
Usually they present as the tiny papules on the skin. The latest method is to use the laser, that is the CO2 laser. It removes the epidermis or even the superficial dermis right away with the very high temperature.
When I woke up, I saw my face was like it's been burned. Where my forehead had been lasered was pus.
This is certainly a sign of infection. After 1 or 2 days, usually all the redness, they disappear, but leaving a scar over the wound.
After treatment, the beautician said I could wash my face as I normally do. I didn't have to take extra precautions. I wonder if the water got the wounds infected.
They think the procedure are quite simple, but complication can occur at any time. That may be the result of the misuse of the machine or the energy level is not adequate. The treatment requires knowledge in so many procedures.
The Consumer Council received 186 complaints against medical beauty services in 2014 and 240 in 2016.
It can be ranged from a very minor burn or irritations to the permanent damage to the skin.
But there's no regulation on medical devices.
We believe there's a pressing need for that. We only have 15 procedures through administrative directive that are required to be performed by doctors. So that means there's no protection to consumers.
Earlier this year, the government proposed a regulatory framework for medical devices. 20 such devices are named. And manufacturers, importers and distributors have to register them before they can be supplied to the market. HIFU, laser and RF devices can only be used under a registered healthcare professional's supervision. Intense pulsed light or IPL, microneedles and cryolipolysis can be operated by personnel who've received device-specific training. There's no restriction for extracorporeal shock wave therapy and microcurrent devices.
When we heard about this proposal, we felt it was shocking and ridiculous. We agree some beauty treatments are risky, so you should regulate those risky beauty services. Why do you have to change it to medical care? You're twisting the ecology.
There is no intention of the Food and Health Bureau of the Hong Kong SAR government to regulate beauty industry. We only really care about the risk that may be posed from these devices that are being used by non-registered persons. The beauty industry, when they use a particular technology for achieving beauty purposes, however, actually the technology is a medical technology.
At least I know who are the doctors is supervising the treatment. If they are doing anything wrong, they will be subject to a very stringent punishment by the Medical Council. They can't escape. And this is what we need in Hong Kong.
This policy is preposterous. Rent and salaries are expensive. You have to charge customers more, as registered doctors would charge too.
Hong Kong has an estimated 6,000 beauty salons. Nearly 90% are small to medium-sized, hiring fewer than 10 staff.
There'll definitely be a wave of closures. Salons not using machines and only doing manual facials can't survive.
If you don't use devices from consumers' viewpoint, you're unprofessional and can't achieve the desired effect.
Randy runs this beauty parlor on her own. She offers basic facials as well as laser and RF treatments.
For example, skin with a pigment problem. If you only rely on traditional beauty treatments and products, there will be improvements. But combined with machines, after one session, you can really feel the difference.
Michelle wants to remove pigment on her cheek by laser.
Pigment removal takes 5 to 6 sections.
Costing about $3,500 in total.
That's by only 2 sections with a doctor. I find her professional. Before treatments, she asks skin details about your skin and inspects to see if it is suitable. She also gives you instructions to prevent problems.
The consultation is more complicated if it is properly done. What exactly the patient dislikes, what she wants, what she is prepared to have the downside of it, all the side effects, the complications.
The most important one thing is the proper medical diagnosis and clinical analysis before you contemplate the proper treatments. And that involves comprehensive medical knowledge, which I would say doctors have this knowledge of doing things.
I've considered my case. An experienced beautician is already adequate. Compare someone who does it every day with a doctor who does it once in a while, who is better. I believe practice makes perfect.
Randy graduated from a beauty school in the 1980s. Over the years, she's taken exams held locally and overseas.
Gradually, the devices became much more advanced. We have to catch up with the trend and learn because consumers receive new information. If customers ask you about it, you have to know how to answer.
We know some beauticians who have dozens of certificates in a clear folder. Many people in our industry are professional, but the problem is how to locate them. We need a professional qualification system to guarantee every beautician who serves consumers is up to par.
Not that simple. Just like a dermatologist, they may just look after the skin. They have to finish the basic medical training, and they have the years of training in the skin conditions and so forth before they can be a specialist in dermatologist.
We are offering beauty services. If you think there are risks, manage them, but don't replace the beauticians. Shouldn't you upgrade them? To ensure they know how to make judgments, to select the right devices, to react and handle problems that arise. I think that's how doctors are trained.
It took 5 years for us to finish medical school.
The debate won't stop. But we can't just keep ourselves status quo and seeing people suffer from those treatments and just hands off.
You have a regulation on the food safety. We have your regulation on drugs, pharmaceuticals. And we don't have any regulation on medical devices, and they're being used on the human body.
You can even set up codes of practice. If they don't follow, you can strip them of their qualifications, so there's continuous monitoring. When everyone is so prepared, I think this is a healthy direction or regulatory format for an industry in society.
There's no compromise on safety. No one wants to see their friends and family members got injured just because they want to be beautiful.
Well, thank you for watching our show. It will be re-aired on Monday, Tuesday, and Saturday, as well as online and on mobile apps. Until next time, from the Pearl Report team, good night, good luck, and good health.